This is Volusia Today, a public information radio program brought to you by the County of Volusia. Here is your host, Kevin Captain.
Good morning and welcome to Volusia Today. I'm Kevin Captain, the county's Community Information Director. Thank you so much for tuning in this morning. Volusia Today is made possible by our sponsors: the Daytona Beach International Airport, the Ocean Center, Volusia Recycles, and Votran Public Transportation. Today I'm joined by co-host Clayton Jackson. He's the Activity Project Manager with the county's Community Information Division. Good morning, Clayton.
Hey, good morning, Kevin. How are things going your way?
It's going good. Can you believe Halloween is right around the corner?
Oh, I can believe it, because my wife has been hitting the shopping stores up to prepare for a Halloween costume party this weekend we're going to. It's a Hocus Pocus theme. There's that new movie.
Hocus Pocus.
Yeah, like she's got me dressing up as a zombie. She's going to one of the witches. Our 2-year-old's going as the little cat Binks, I think. And actually, our 8-year-old's going as the Book. So she's very crafty. So she's got the costumes on point, as the kids would say.
Well, you know, it sounds like you're getting all set with costumes, but you didn't bring any candy here for all of us in the studio.
No, sorry. I'll put that down for next year. I'll bring that in.
Well, today's guest is, we've got two guests today. We've got Ethan Johnson. He's the Assistant Director with the Volusia County Health Department. Good morning, Ethan.
Good morning.
And we've also got Wendi Jackson. She's the Public Information Specialist, also with the Florida Department of Health in Volusia County. Good morning, Wendi.
Good morning.
Well, thank you both for being here. We've worked together extensively through the pandemic. We were, strong partners, and Ethan, the health department played a huge role in providing lots of information during the pandemic. And now we've been dealing with Hurricane Ian. And since the storm, obviously, when we look back and we look to see all the efforts that the health department contributed, one of those is sheltering. And we've had Jim Judge, the emergency management director, speak previously about shelters, and he likes to say that shelters are the lifeboat, not the love boat. But nonetheless, there's still people that need them. And in particular, besides general sheltering, I know we've kind of tossed around some terms and names and what we call it, but there are people that have medical needs, for example, oxygen, things like that. If they don't have electricity, that's where you guys can come in to help and assist and manage the shelters that have medical needs. Tell us a little bit about your role with that and how that works.
Sure, yeah. So the listeners are probably familiar with the term special needs shelters, which sounds pretty broad, but specifically really what we're doing at the health department, we're staffing those shelters that are taking care of individuals who are dependent on oxygen, electricity, or they have some type of memory impairment issue. So we are staffing shelters to care for those individuals during an emergency, and of course, as you mentioned, as a last resort, because we all live in Florida. We know that we should all have our hurricane plans ready once June hits, and we really encourage people throughout the year to take advantage of that planning process, because like Jim says, it's definitely not a love boat in there.
Right.
It's not cozy. However, we do staff these shelters with nurses and with support staff, so we're able to care for these individuals. They're also asked to bring a caregiver with them as well, but again, last resort.
And even when you mention it, I know that there's been emphasis on one caregiver with them, not more than one, because the space is limited.
Right. So the difference between the special needs shelter, there's several differences, but when looking at the special needs shelters versus general, the space is very limited, and when we have individuals that are dependent on electricity, let's say, the space is even more limited. So we want to make sure that you're only bringing one caregiver with you into the shelters.
And one thing we're also aware of is that if they are on prescription and medication and so forth, that's not provided at the shelters. They do need to bring their medicine or any other medically related supplies with them to the shelter. Is that correct?
Absolutely, absolutely.
Okay, all right. Well, Ian brought on a water rain to us and led to horrific flooding. It said we had Ben Bartlett on a couple weeks ago, and he said a 500-year or maybe 1,000-year storm.
Yeah, sometimes some are saying 500-year storm, some are saying 1,000-year storm.
Well, regardless of how you say it, it's not good. Obviously, a lot of our citizens have had property damage, the flooding, and so forth. But something that may have been overlooked is that some of our citizens do use wells for their water, and the flooding may have led to some contaminants getting in their well water. and we're hearing that the health department is actually temporarily waiving fees for citizens who may have had their wells be contaminated. Could you want to elaborate a little bit about that?
Sure. So as long as the demand persists for individuals who were impacted by flooding, who rely on private residential wells for their potable water, we are waiving the fees for that. All they'd have to do is contact us at the health department, calling 386-624-0483, or they could email vchdwellirr@flhealth.gov. I know that's a long email, so it might be easier just to call the number.
Call the number?
Call the number. And you can also go on our website and you can just call our main line and we'll route you there. But one of our inspectors will actually come out to take the sample. So we can't accept a sample that you bring in.
Oh.
Our inspector will go out, take the sample, and then provide you with the results and some mitigation practices, of course, depending on the results of your water and while you await the results. One thing I do want to mention, though, is if you were not impacted by flooding or if this is a new construction, then this fee waiver doesn't apply to those residents. We really want to keep it specific to those who were impacted by
That makes
flooding.
sense.
Mm-hmm.
Because you're obviously more prone and there's a higher probability for contaminated water if you're in that flooding area, but not so much so if you're not impacted.
Right.
And we just want to reiterate, don't show up to one of our health department locations with a bottle of water.
Yeah, we actually have a lot. Yeah, so don't show up with a bottle of water because maybe your water isn't contaminated, but you could have contaminated on your way here.
Sure.
So just let us know and we'll come out there and collect the sample.
Oh, that's great service right there. That's excellent.
Speaking of water and flooding, and most of the water has receded by this point. I think there's still some areas near Astor and Stone Island and things that are still at the maximum flooding stages, but forecasting continues to suggest that there's going to be further receding. Hopefully that's assuming we're not going to get a whole ton of rain anymore or anytime soon. But coming up with Halloween, kids walking out in the streets, things like that. If there are areas of standing water, things like that, it's not good to be anywhere near that. Is that correct? I mean, that's all contaminated water.
Oh yeah, absolutely. So flooded waters pose several health risks. Part of which is because the water is potentially contaminated with bacteria or viruses, some of which are naturally occurring, like Vibrios. I know we're seeing that in the Southwest Florida, where the people are more familiar with like flesh-eating bacteria, which is kind of like a shocking thing to see. But
Just hearing that,
you're right.
That's enough
gives
stale
me
water
goosebumps.
altogether.
So, I mean, and risk are different depending on the scenario. Like if you're in flooded water and you have an open wound, and we live by the ocean, you are at a greater risk of being infected by something like that. But I think it's also important to note that outside of contamination, there are other risks such as down power lines in water, which is extremely dangerous, encountering stray animals that aren't usually in an area, whether that's snakes, rats, other rabid animals possibly even, and then of course there's a risk of drowning, and especially during an active storm when we have these flash flood warnings. So it's definitely important during trick-or-treating or really any other time that you stay away from flooded water or flooded areas. Very dangerous.
So while the YouTube videos and Facebook videos may look like fun, people out there playing in the water after a storm, so forth, that's not really recommended, is it?
Yeah, probably not the best idea for sure.
Speaking of you said Vibrio, and we hear that it's flesh eating. It's really not eating the flesh, right? It's killing the flesh.
Right. Yeah. And what it is it's an infection.
Yeah.
Just like any other, and there is treatment, for that. So it's not,
But it rapidly grows quickly.
It grows exponentially, and then there's also a risk associated with it if congested. So it's not just about it coming into contact with a wound or open skin. You can congest it, and then you have other issues as well.
You mentioned South Florida. Have we had any cases in Volusia, to your knowledge?
To my knowledge, I don't believe so recently, but I'm not. No. Yeah.
Okay, good. That's reassuring.
Yeah.
And just kind of go on the lines of water, mold mitigation. I know we've talked about that before, but anybody's home who's experienced a lot of flooding, mold may be persistent. So probably not the best idea just to take some Clorox and try to wipe that.
Yeah, and
those materials down.
and I know it's hard because some people have items that are very important to them that have been damaged. But we have a long list of things if you visit our website on how to mitigate mold, or just some things that you need to get rid of.
Excellent.
We're talking with Ethan Johnson and Wendi Jackson with the Florida Department of Health in Volusia County. We'll take a quick break, and when we come back, we'll talk a little bit about that thing called the flu, because it's that season. Stay with us.
Hi, I'm Tammy Melfors, Deputy Chief with Volusia County Beach Safety. We have some important safety messages we wanted to get across to everyone. Some of the new threats are debris on the beach, collapsed seawalls. Whenever you see those collapsed seawalls or structures that are compromised, don't allow your children to play on them, get near them, stay as far away from them as you can get. It's extremely important to obey all of the barricades and the signs. My biggest fear is if any of these collapse and somebody's near it and gets hurt. I wish I could give you an estimate when it would be safe to walk near seawalls and other structures on the beach, but I can't. We're working very hard to get everything fixed, so it's very important to pay attention to our barricades, our signs, and stay as far away from the seawalls as you can.
Volusia County is a beautiful place to live, but if
we don't respect it, who will?
Litter is a problem, one that we can solve.
But it's going to take all of us working together.
What matters is that we all do our part.
Don't be a litter bug.
And pick up litter whenever you see it.
Every litter bit counts.
Keep Volusia beautiful.
We're back. I'm Clayton Jackson, along with Kevin Captain, and you're listening to Volusia Today, a public information program brought to you by the County of Volusia. So, Ethan, let's pick up where Kevin kind of left off about this thing called the flu. We're hearing it starting to pop up and say hello across the country. So, what advice can you give to our listeners to encourage them to get the flu shot?
That's a great question, and I love that you put it that way. It's popping up across the country. So, because what we've seen over the last few years is that because of all of these COVID mitigation strategies, flu has kind of naturally decreased. We haven't had as many cases because it's the same mitigation that's used for any respiratory illness, right? But now, we're not doing those same things. We're not wearing masks. We're not doing this. We're getting back to normal, but we are seeing an increased number of flu cases. So what that means is there'll be an increased number of individuals who are especially at risk who have severe complications from flu. So it is important for us to get that vaccine. And of course, your risk for complications with flu increase with age, increase when you have other issues with being immunocompromised, and then of course you have other comorbidities. So that's why getting that flu vaccine is important. Right now, we have the standard flu dose, which can be given to individuals, I believe, as young as 6 months. And then we have the high dose, which is for 65 and older. And you have to be 65 or older to receive the high dose.
So that's for the flu shot. Let's talk a little bit about the COVID vaccine, because COVID's still around. There's still people getting it. That vaccine has changed a little bit. Now we're calling it the bivalent. What does that mean?
Yeah, so the bivalent booster, the simplest way to put it, it's the only booster being administered now. And the bivalent booster takes into account our Omicron surge. So for continued protection, and really what we want to move into the language like it's a bivalent dose, right? So it's an additional dose, almost similar to how we're talking flu right now. So if you've completed your initial series, then you are eligible to get the booster, which is the bivalent booster. That'd be the only booster that you receive. And it's your choice. We are offering that here at the health department for individuals who are 12 and older.
So just to clear up things, because I was a little bit confused about this as well. When people hear the term booster and the bivalent booster, they're one in the same. So people shouldn't be coming in asking, well, I just want the regular booster, not the bivalent. It's one in the same,
right?
Correct?
It is. It is the bivalent booster is the booster that's being administered. The original dose, let's say you've never gotten a COVID vaccine before, you would still receive that original, your original series. You would still receive that if you've never gotten a vaccine before.
So you have to have been vaccinated initially with one of the 3 vaccines for COVID.
So it gets not necessarily. So if you receive Johnson or any of those, you can receive the bivalent. You can still receive the bivalent now. However, those are the only options. That's what I'm saying. The original dose, but if you come and you ask for a booster, you'll receive the
booster's
bivalent.
only the bivalent.
That's only, yeah.
Now, what if my wife is listening? She's probably going to say you didn't get it yet, and you got to get both. But can I get both at the same time?
You can, meaning the bivalent and the flu vaccine?
Yeah, the bivalent and the flu.
Yes, you can. You can.
One in each arm, that kind of thing?
One in each arm is what they'll do. And I know some people are like, oh, well, that's going to be... Some people actually have no symptoms when they get it. Some people do.
Yeah, that's what I'd be worried about. I'm not going to be down the next day, with...
Well, and what we always tell people is that, how you feel if you were actually to be infected would be much worse than the symptoms that you experience for a few hours or a day.
That's a good point. And those feelings after getting a vaccine or a booster, it's really not the illness itself. I understand it's your inflammation in your body after just responding to the
vaccine. To the vaccine.
Yeah.
Which means, in essence, the vaccine is working.
Good point.
And about time frames of people who have already had their booster. For example, I got my last booster in December 21. So am I technically eligible to go in right now and to get the bivalent or the booster?
Right. So anyone can get the bivalent or booster. Anyone can get the booster as long as it's been at least 2 months since your last dose of a COVID-19 vaccine.
So 2 months, because I know we've always been hearing this 6 months.
Right,
6 months. So 2
So
months.
at this time, it's 2 months. As long as 2 months have passed, you can get that booster.
So what are your hours? I mean, is it free? If somebody in the public wants to go and get both vaccines, what are the options in terms of days of the week? Hours?
So our hours, we have normal business hours, 8 to 5 at the health department. To avoid waits, it would be best to call first to schedule an appointment. However, we do take walk-ins at the Holstenbach and Orange City locations. In terms of cost, it depends, but we will never turn anyone away. So you can get your vaccine. But also it's important to note, especially with the flu vaccine, it's widely available. Pretty much any local pharmacy, definitely your primary care physician. So if you want the vaccine, it's there.
Okay, awesome.
What about for our senior citizens and the pneumonia vaccine? Is that something they get through their doctor or the health department?
They would need to consult with their primary care physician on that, for sure.
Because that gets into more about their health conditions and comorbidities and whatever else. Interesting. All right, well, we're talking again with Ethan Johnson and Wendi Jackson with the Florida Department of Health in Volusia County. We'll take our last break and come back and talk a little bit more about what's happening at the health department. Stay with us.
Subscribe to the Volusia County YouTube channel.
Let's go!
There are so many great places to explore.
And things to learn.
We have countless features showcasing history, nature, wildlife, and recreation. Subscribe and hit the bell icon.
Go ahead, subscribe.
But that's not it. There's more. Subscribe and hit the bell icon and fully explore.
Score!
I'm Will Roberts, your Volusia County tax collector. In November, my office sends out the annual property tax bills. Most people receive a bill the old-fashioned way, by mail. Others also receive their bill electronically. But if you have not received your bill by the middle of November, please contact our office.
Thank you for calling the office of Will Roberts Tax Collector. How can I help you?
You may pay all of the taxes at one time. The earlier you pay, the greater your discount. Taxes can also be paid through the quarterly installment plan or by partial payments. But no matter how you pay your bill, please make sure it's paid by March 31st. For more information on your tax bill and about payment plans, please visit our website. The address is vctaxcollector.org/taxes. That's vctaxcollector.org/taxes.
You can access Volusia County government online at volusia.org. Listen to county council meetings, pay for permits or tags, or search the property appraisers' databases. Volusia.org is your Volusia County government information resource.
We're back. I'm Clayton Jackson, and this is Kevin Captain, and you're listening to Volusia Today, a public information program brought to you by the County of Volusia.
Thanks, Clayton. So we've got Wendi Jackson and Ethan Johnson with the Florida Department of Health in Volusia County. So we talked flu, we've talked COVID boosters, we've talked a little bit about your role during the hurricane and sheltering. The health department does a whole lot more than what we've just touched upon. Wendi, can you give us a snapshot of some of the other services and programs that are available through the Florida Department of Health in Volusia County?
Sure, thanks, Kevin. So one of the things that we're really working on right now is we received a special grant from the state of Florida, and it's called CORE, and it stands for Coordinated Opioid Response. And because we have, unfortunately, a high case of overdose in our county, that's the reason for the grant. So it allows us to work with community partners, Halifax Health and SMA, VRA, to provide special care for those that are struggling with substance abuse. And along with that, we also have been given permission to distribute naloxone, which most people know it as Narcan, which is usually available only by prescription, but we have it available in our clinics. It's given to people who are struggling with overdose, like just in case kind of situation. But also if you have a family member that's struggling with overdose, like you could get it from our clinic and have it on hand if you wanted it. So that's kind of unique, and we're kind of excited that we get it because it can be life-saving.
So I think of that as always being something in the hospital or on the ambulance, but now through this CORE program, you're able to deploy the Narcan to those that are vulnerable.
It will still be available, if you get emergency response coming your way. But also, part of this is that it allows us to have peer counselors or people that have lived experience working alongside of the emergency responders and in the hospital ER, so that when a patient comes in that's struggling with an overdose situation, that person gets to know them a little bit and then follows them throughout their care, and not just their medical care, but also like their mental health, and works with them on even things like housing and stuff. So it's a whole coordinated response.
That's great.
So just to make sure I heard this right, if I have a family member who may be suffering from addiction, I could actually come to one of the clinics and you would provide me Narcan to keep at my house?
Yes, you just need to ask the ladies at the front desk in our clinic and they can help you get that. And there are some pharmacies in our county that when you receive a prescription for a certain scheduled narcotic, they will also give you Narcan, but it's kind of...
And how much would I have to pay for one of those?
It's free, Clayton.
Oh, could you say that one more time?
Free, Clayton.
Okay, great.
And I mean, we're really promoting secondary distribution as well. We'll give you some for if your son is struggling with addiction and you need some take home from him. We'll give you some to give to your son's friend's family as well. So that's really the point of us being a distribution point like that. Yeah.
Well, and that's so important because Wendi, you mentioned about the prevalence of overdoses, and Volusia County is right in there with many of the other 67 counties in Florida, and some of the stuff that people are buying on the street, some of the fentanyl is 100 times stronger. So having Narcan is a matter of literally life and death in some of these cases.
Correct. Yeah, it's Red Ribbon Week in Volusia County Schools this weekend. Our health administrator and our overdose prevention coordinator, they went to New Smyrna Beach High School and gave a little talk to the kids about, this is your future, and you don't want to risk that future by taking something that you don't really know what it is. You may think you're getting an Adderall or some pain reliever, and that's really not the case. So it's never safe to take medication from somebody that you don't know, and
Good advice.
So there's also that program called WIC, which, contrary to popular belief, it is actually separate from the SNAP program that's administered by the Florida Department of Children and Families. So WIC is administered by the Health Department. So do you want to touch a little bit about what WIC is?
It stands for Women, Infant, and Children, and when a woman reaches a certain level of income, they have struggles or whatever, and they become pregnant, It allows them to get infant formula if needed, and a card that they can use to shop with that has options to buy nutritional things at the store for them and their little ones up to the age of 5.
And it's an added safety net for mothers and children struggling. We also have breastfeeding counseling as a part of associated with WIC as well. But since you brought WIC up, I do want to mention back to the flooding conversation on Keach Street. That whole area was hit pretty bad. That is one of our primary places for WIC in Daytona Beach, so we're displaced at the moment, but we're currently trying to develop a plan to have a small space at our Holstenbach location so we can still have some of those services over here. However, at this time, most of WIC services are still being delivered virtually.
And speaking of the Keach Street facility, the question that comes up, not just with this situation, but anything related to the storm, is when is it going to be open? When is it going to be fixed? And you might not be able to answer that, right?
Yeah, and unfortunately, that's we don't know. We don't know. We can say that everything that was the services provided at Keach will still be provided somewhere here on this side of the county in Daytona Beach, and currently are being provided. But that specific location at this time, we just don't know timeline-wise.
And the main location, when you say Holstenbach, perhaps not everyone knows where that is. It's not a very widely known street.
Right.
How does the average person get there?
Right. So the easiest way, if you're going down International Speedway.
Okay, I know that road.
Yeah, right. You make that right on, well, it depends on if you're going east or west. If you're going towards the beach, you're going to make a left on Bill France, which is that street right before the mall and IHOP and all of that. And
right across from the racetrack, right?
Exactly.
Right by Bahama Breeze.
There we go.
And you're just going to take that all the way down, and then right before you get to Clyde Morris, you'll see Holstenbach on the left. And it's a great location because, we're co-located there with a lot of county services, community assistant, veteran services, the tax collector, as well as at the health department. We have a dental clinic there. We see children and West Volusia Hospital Authority clients, and provide several other resources there.
And as this October, it is Breast Cancer Awareness Month, and I know the health department does a few different services relating to women's health. Do you want to touch on that real quick?
I think part of the beauty of it is, Clayton, that if you are uninsured and you're, I think it's 35 or older, you can step into a clinic and get a breast screening. And then if you have issues, we help see you through your treatment and pay for your treatment all the way through because you started at the health department. So that's pretty cool.
So once you're in the system receiving treatment, you follow all the way through the course of the treatment.
Halifax or Advent or wherever, we work the plan, but yeah, it's covered by us.
And if you're uninsured, we can also help with the actual exam itself,
yes,
screening itself.
And real quickly, in a few seconds, the dental clinic.
So the West Volusia Clinic is located in Orange City, and they're accepting adult patients for cleaning services, all kinds of things. So it's a really good option if you have West Volusia Hospital Authority or some other kind of plan.
Well, definitely a great service for those that maybe need a free cleaning or other dental services. So very, very good. Well, Ethan Johnson, Wendi Jackson with the Florida Department of Health in Volusia County, thank you both for being on the show today. We really appreciate what you're doing for the residents of Volusia County.
Thank you. Thanks for having us.
Yeah, thanks.
With that, we'll close Volusia Today. Thanks for listening. Take care, stay safe, and help your neighbors.
If you have a comment about Volusia Today, or if there is a topic you would like to hear featured, please contact Volusia County Community Information at 1-866-345-0345.